So the liver is very important in the body because it helps in the synthesis of proteins. These proteins function in many things, such as carrying of certain ions, metals, hormones, and drugs, as well as maintenance of oncotic pressure in the blood. Some of these proteins carry an immunological function that help us fight against certain microorganisms invading into the body. This is why it is fundamental for the liver. Hello and welcome to Medicine in 5 Minutes. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we'll look at medical topics in the shortest space of time. In this episode today, we shall focus on hepatocellular carcinoma. Remember that hepatocellular carcinoma accounts for 90% of primary hepatobiliary cancers, most of them being cholangiocarcinomas. It is characterized by aggressive angiogenesis, which is pretty much blood vessel formation. And it is worth noting that most of the tumors that actually occur in the liver happen to be secondary tumors, and rarely are they primary tumors. Some causes and risk factors include alcoholic liver disease, non-alcoholic fatty liver disease, which is slowly becoming more common than alcoholic liver disease. However, worldwide, viral hepatitis is still a very major concern, leading to hepatocellular carcinoma or hepatoma, which is why we tend to vaccinate people against hepatitis B virus. Diabetes is also an independent risk factor that predisposes individuals to development of hepatocellular carcinoma. Clinical features may include symptoms of chronic liver disease or acute decompensation. And whenever an individual is going through acute decompensation, this is usually a poor prognostic factor. Some of these features of chronic liver disease may be signs you may see on your physical examination, such as spider nevi. You may have right upper quadrant mass or right upper quadrant pain. There may be jaundice that may be there if there is some biliary obstruction, and this patient may actually be indeed in hepatic encephalopathy. Some investigations include a liver ultrasound, which may show nodules. If the nodules are less than 1 centimeter, repeat the ultrasound in the next 6 months, and if they're greater than 1 centimeter, repeat a CT scan or an MRI, and this will also result in a biopsy if the radiological findings are non-conclusive. But when you do this biopsy, please beware of seeding. You may also order for alpha-fetoprotein, which is a tumor marker. It is 50% sensitive, but usually it's more useful in the later stages of the disease, but it may be used in conjunction with ultrasound to monitor the disease in cirrhosis. You may also order for some liver enzymes such as alanine transaminase and aspartate transaminase, and you may also do liver function tests. You may check for your prothrombin time, your serum albumin time, and you also may check for your bilirubin. In the management of the condition, first-line management for solitary tumors that are less than 5 centimeters in patients with good liver function, you may perform surgical resection. For patients that have unresectable tumors, usually due to poor liver function, you may actually do transplantation, but they should actually fall under the Millen criteria. So the lesion should be one which is less or equal to 5 centimeters in size, or 2 or 3 lesions that are less or equal to 3 centimeters in size with no evidence of extrahepatic or vascular disease. You may also perform radiofrequency ablation, which is an alternative to surgery for localized unresectable tumors, and this may be curable modality treatment in small tumors. You may also undertake transarterial chemoembolization, which is a non-curative treatment for these larger tumors that are greater than 5 centimeters. It may also be used as a bridge to a transplant. Chemotherapy with sorafenib may be used for advanced disease, and often hepatocellular carcinoma is a very big burden for the country as well as for the world at large. Thank you for taking your time to listen to this review lecture video on hepatocellular carcinoma. If you haven't yet subscribed, please subscribe to the channel, hit a like, drop a comment, and share the channel. Share the video with someone who you think it may help. Until next time, my name is Dr. Moses Kazevu. Bye-bye.